Many of you would have been to Thought Brokers events before, I imagine. If you haven't, you really should. I won't give you the spiel. Just go to thoughtbrokers.com.au and have a look. They put on wonderful events with wonderful speakers. And Leonie's going to speak to us now about selling various parts of our body. I think kidneys.
John, is there any time for Q&A?
If we have time. It's more important that we let the speakers first.
Sure.
Thank you. Thanks, John. So I'm going to be putting an argument to you today about why Australia should be the sort of place that we trial and market kidneys for transplant. So this is not a new market. It's a bit of an old idea, actually, about using a market model or some sort of financial incentives to increase the supplies of kidneys available for transplant. Globally, as you know, there's a shortage of kidneys in most countries, and in most countries also there's a prohibition on selling or buying kidneys. We know that kidneys are the optimal treatment for end-stage kidney disease. So you're going to have a better lasting life if you get a kidney from a live donor than if you do from a dead donor. But despite this evidence, the Australian government here is hell-bent on increasing the numbers of available kidneys from dead donors. But this is sort of a self-defeating policy anyway, because to actually get a kidney from a dead donor, they have to die in an intensive care bed. And there's actually only 1% of deaths, hospital deaths, actually take place in intensive care beds anyway. So we're limited in that way. The Australian government is also very much hung up on awareness campaigns. You've probably all seen ads or received letters asking you to be aware of the need to donate after you die and to talk to your family about it. But actually, that's not really going to solve the problem either. It's actually a policy and reform issue that needs to happen, not an awareness-raising issue in the population. So the policies that have been tried in Australia to date have pretty much failed to increase the rate of transplants that are taking place, particularly at a time when we have increasing rates of diabetes and lifestyle diseases that do lead to kidney disease and then obviously in some cases end-stage renal failure. A couple of years ago, Kevin Rudd, when he was Prime Minister, tipped in an extra $150 million to set up a new organisation called the National Organ and Tissue Authority. They focus very much on the awareness-style campaigns, and their outcomes have been incredibly modest and incremental. They haven't really saved many lives, and the outcomes they've espoused have basically been about self-reported perception data about, altruism and things like that, and the idea of donating kidneys. So we've got a pretty serious policy failure situation on our hands. I want to give you a bit of background about the need for more kidneys for transplant here in Australia. So for over a decade, we've had about 1,200 people each year stuck on the kidney waiting list, waiting for a transplant. We ration kidneys, not just giving out kidneys, but we actually ration the waiting list. So in Australia, doctors often don't bother to add you to the kidney waiting list. Even if you're healthy or young and it's likely that if you got a transplant, you have a great outcome. In fact, we have about 10% fewer patients being referred to that waiting list than most other countries. So with more people going on to, the alternative is dialysis. So we have more people getting dialysis now. We've got about 11,000 people a year. Well, that was the 2012 figure, and it costs us about $1 billion to give that treatment. Dialysis is the alternative treatment, but it's considered inferior from a medical point of view. You're not going to live as long or have as good quality of life if you're on dialysis as opposed to a kidney. But from an economic point of view, it's a total balls up. Basically, dialysis costs $83,000 a year compared to a transplant, which is a one-off, at $65,000 a year, and about $11,000 ongoing for drugs, anti-rejection drugs. So, in Australia, we have about 130,000 people with kidney disease at the moment, and a big proportion of these people are from lower socioeconomic indicated kind of groups. There's also a really high proportion of kidney disease among the Indigenous population, and Indigenous people tend to, they're less likely to receive a kidney at all, and they're also more likely to have a longer wait on a waiting list if they do get a kidney. So I've kind of come to this from an ethical point of view, so thinking about some of the ethical arguments that are involved in creating a market in this way. And so I think that for those sorts of quite obvious reasons. Australia needs to increase the number of transplantable kidneys, but the big problem is that this idea of offering some financial incentives for people to be able to sell their kidneys has pretty much been in dispute for 40 years. There's been a very entrenched moral debate about this. So on one hand we have the people who are quite open to the idea, and often they're nephrologists, they're doctors, they're people operating on patients who see that they need to get kidneys from somewhere. Then on the other hand, and often it is another part of the medical community that says basically there's just no way we can conscionably accept the idea of selling a body part. So the sorts of arguments that are used to enforce the current prohibition in most countries are things like, we have an issue with the kind of Kantian ideal of, not using others as a means to an end, or that selling a kidney will allow us to exploit the poor because it'll be poor people who are more interested in, making some money that way. I would actually disagree with that in Sydney anyway, the property market. I think there'd be a lot of young families keen to sell a couple. It also compromises the sanctity of the human body. So it's the sort of quasi-spiritual arguments about bodily integrity and things like that. The idea of relying on donated kidneys, this altruism, which I'm pretty sure came up earlier in some of the other discussions today, the idea that altruism is such a lovely feeling that it doesn't really matter if people are dying and sick because they can't access this lovely altruism. And of course there's lots of hyperbole about slippery slopes and slavery and things like that thrown in for good measure. So the arguments against selling kidneys or buying kidneys are really quite philosophical and emotional, I would say. If there's time later, we can get into them in more detail if people are particularly interested in them. But I think most of them can be answered through market design. And I'm not going to propose a free market in kidneys because I actually am concerned about the idea of doctors like Liam running around with scalpels while they're all under anaesthetic. I kind of don't like the idea of. I think medicine is something, and treating people is something that there's a good place for regulation in it. So I'm going to propose a market so what we're going to use is some financial incentives and a particular market model to kind of get around some of these problems. I reckon that if we can design a market in kidneys that doesn't harm people more than the existing donation model, I think we're pretty fine. And so we can answer a lot of those philosophical and emotional arguments, but there must be something else that's stopping people from feeling comfortable with the idea of selling a body part. And I actually think it's to do with prejudice against the market. So the health sector, certainly in Australia and in lots of other parts of the world, is populated by people who are pretty suspicious about capitalism. And it manifests as this quite loose prejudice against markets and money and things like that. It's very much a left-dominated workforce, and most of it is captured by government anyway. So I think that is an issue that pervades this that really hasn't been exposed, and I'm sure Liam will do a lot to expose it shortly. So despite this sort of prejudice, we're seeing a few examples of trials coming through to show that financial incentives do have a place in healthcare. So for example, recently there were some results of a trial in the UK to get injecting drug users to go through the process of getting their hepatitis injections. So you have to go to a doctor for 3 different injections over a period of time, and obviously these people are having too much of a good time being wasted to rock up for the next appointment. But by giving them a modest incentive of just a couple of £100, they found that they could increase their vaccination rates by 40%, which was unheard of before. So there is a place for financial incentives. So I think also the other side of this is that the idea of kidney markets has kind of got a bit of a bad rap because they haven't played out so well in some countries where they've appeared. So I'm sure you've all heard quite awful stories of destitute Indians and Bangladeshis getting their kidneys cut out by kidney sharks, and the kidneys are shipped back off to America while they're sent back to the field to work without any follow-up care and things like that. So those sorts of poorly regulated or black markets in kidneys, which have cropped up in India, Egypt, Bangladesh and the Philippines, have really given the idea a bit of a bad rap. the two important issues that underpin them are basically that those jurisdictions have very little access to healthcare for their populations, particularly poor people. And on the other hand, they don't have the regulatory structures involved that could actually protect them if something went wrong with the crazy sharp doctors. I think we should consider Australia the right sort of place to trial a kidney market. We don't have either of those problems. We have universal access to public health care, which I'm sure you probably often disagree with. And we also have relatively strong rule of law. We have great reputation for actually carrying out experiments, even from the early days of being, a Benthamite kind of place when Australia started. These days we have had some great successes with experiments like the medically supervised injecting clinic in the Cross, which started out as a really controversial prospect and has actually just been so successful it's just rolled on seamlessly into policy, and that's the way it is now. So compared with the developing countries, I think we have the sort of institutional capacity as well as the sort of access to healthcare that you're required to actually be able to buy and sell kidneys here in Australia. So, so my proposal isn't a very free market one, but I think the kind of model that could work is a monopsony. So what that means is that there's a sort of single buyer in the market. I can't buy Tim's kidney, he can't buy mine, but the government or whoever the public health authority is could buy a kidney for a fixed price and then allocate those kidneys using the existing medical criteria. So this means there's not going to be bidding wars, where the rich people can access kidneys and poor people can't. We will just stick to the same criteria we use to allocate them now, which are mainly medical grounds, sometimes moral grounds, certainly with livers. But so if we stuck to that model, I think we could kind of balance out those equity issues, but then be able to kind of stimulate enough more supply into the market. So I hope that we can talk about this a little bit further, and I think the anti-market prejudice, which also I think has come up in Jen's talk, is something that would be really awesome to have your thoughts on. So thanks.